How do you see community-based programs like those that you have at ACCA addressing the emotional needs of both seniors and their families impacted by dementia?
Think community organizations have a key role. One, we have to develop trust, and we have that. It should be more led by families. So we're not telling you what to do. What is it you need, and how can we support you? Creating that safe space for families and caregivers to come and have access to. That's really important, and let them lead the conversation. So we developed more social supports, but also strengthening their voice to amplify the issues and to address some of the gaps in services. So really bringing that lived experience to the conversation. The academic is really important, but when do we and the medically critical important, but how do we bring lived experience to the conversation? That, like, even today, listening to all the speakers and those who have experienced dementia in their families, there's some things that you share that other individuals might not be aware of. So it's really critical to have that space, and the ACCA, for example, being one of the voices in our community, to take that on and to create things like even ambassador programs where organizations such as the Alzheimer's Society partnering with community and doing um, doing a transfer of payment back to community, not only that they're doing it, but also to build the capacity in communities. And I just pick on the Alzheimer's because they're one of the lead groups, for example. But what does partnership look like, and how do we really get to the people on the ground? So working with NGOs or on the ground like ours, and to create community-centered responses. So you will become a conduit, but not necessarily the provider, but a conduit to change, and building the capacity in those communities that we're talking about, the Black community, be the Indigenous community, South Asian communities, that we're really concerned about because of the numbers that we're seeing. How do we build capacity in those communities to help to champion the issues in terms of more access to more relevant programs and services, bringing the voices of those affected to the conversation. So I think it's really critical. It's a really great part of a model that we need to implement.
How do you balance caregiving while helping your dad stay engaged with your family and community? And what advice would you offer to others in similar situations?
I have to say, we're very blessed because in our family we have it's a very large family, and we have a large community support. Because of church, there's a lot of people, and it's interesting. It's the older generation more so than the younger ones that come over and um, relieve my stepmother, or watches, or we can call on someone and they will be there. I'll give you an example. My dad had to be admitted in the hospital because something had happened to him, and he can't speak for himself. He can't say, "Oh, my back hurts, my neck hurt." He can't say anything. And for the first 3 days, someone had to be there, like pretty much 24/7, right? Because he wasn't admitted into a room yet. He was in the emergency area, and people from church volunteered to take times to come and stay so that the family didn't have to be there all the time. So yes, a community, for those who have a community that's helpful, that's essential. And for individual, if you know, friend, someone who's has a family or relative that's dealing with this, sometimes just saying, "Can I come and stay with them for an hour?" It gives that person a time to go and just do something simple as go to the grocery on their own, like without having to, like when you have someone with Alzheimer, and the further the condition goes along, the more someone has to constantly be with them, and you have to schedule every single thing that you're doing to make sure that the person's being watched, the person's with you. And just like, I mean, I can just go to the grocery store if I want to, go wherever I want, but when you're in that situation, it's not so easy. So having a community around you to help, that's very beneficial. And within your family, the person who's dealing with it, they need to speak up sometime and say, "I need help. I can't do this by myself." And everybody needs to be willing to help, because it's a challenging situation. So we're very happy that we have people to help us. The best thing I can say is, if you know, ask if you can help.
How can we close gaps in access to care and support services for Black individuals with dementia?
Oof, that's a question. I wish I had someone from the government on the call as well. I think closing gaps in access to care, it's similar to providing care from a holistic perspective, like it takes a village. It kind of takes a village to close those gaps when it comes to care. With my father, we had his doctor involved, his geriatrician, we had a social worker, we had, he used to live in a condo. We had the condo managers involved. They knew of his condition. Everybody sort of created a village around him to make sure that he was okay. So if they found him wandering, the manager would contact me, we'd call the police. So we had these points of individuals and communities along our journey. Thank you, exactly. A wraparound approach is what we did. Closing gaps to care really, for me, it also involves being educated on the disease and the disease trajectory and what you need to know. When you go to the healthcare system, when we talk about barriers for seniors, there's also a barrier for family members as well. Sometimes you're dismissed because you don't really know what to say, you don't really know what to ask for, and you don't know what you don't know. So getting all the information you can really empower you to ask the right questions at the doctors, to ask the right questions of the social workers, to ask the right questions, be able to say, I need this for my loved one is experiencing this, I need these kinds of services. And that goes a very long way in ensuring that you get the right services that you need, either in hospital or in institution or at home as well. So I say knowledge, I say also leaning on, as Charmaine said, leaning on supports around you. So care doesn't have to be just in hospital. Care can also be at home. So having someone who may be at the church or your local community center, a neighbor, whoever it is, who can support you, dropping by to either give you some respite, to give you some time to even just breathe or take a shower or do whatever it is, or someone, my girlfriend, she actually got some tongue scrapers for me and my father because he needed it. I didn't know where to get them. She says, I'll get them for you. Little ways that people can help you can help close those gaps in care, either in knowledge or in access to care. Having a friend to drive you to go pick up medication is also very helpful. So unfortunately, because our healthcare system is not as strong as it should be, we do have to rely on each other and really create that village to support one another in each step of the journey.
I know we've mentioned the stigma being a problem, and so I'll just like to hear quick, maybe short answers, to say that what role does the stigma around dementia play in the Black community, and how can we work to reduce it?
I wanna actually give a little story. When my father was first diagnosed, my immediate family, so my stepmom and my brothers, they had a hard time coming to terms with it. They couldn't believe it happened to our family, and they couldn't get it. When they began accepting it, my extended family, aunts and uncles, they didn't accept it at all. It took them about 6-7 years for my aunts and uncles to say, okay, he has dementia. And in those 6-7 years, it was quite lonely for my family because we didn't have anyone to really rely on and really talk to and help us understand and come to terms with it. Stigma comes in many forms. Stigma can be cultural, it can be religious. I was actually told by one of my aunties that maybe, this is a curse from from my father's family onto him now. Stigma needs to be broken down. Stigma needs to be broken through. It causes so much extra hardship and burden for the person with dementia and the family member for reasons that are not necessary. One way to combat it, I would say, is talking, normalizing it, talking about it, getting it out, letting people see this is dementia. And dementia, for the most part, dementia is a very scary disease. And realistically, it is. It's a progressive disease. There's no cure. And each stage of the disease, there's different changes and behaviors and different needs and different expectations. And people can get very scared of what that looks like. And I tell people, rather than focusing on the worst parts of the disease, try to find the joy and the beauty and the moments that you have while you're on the trajectory. Like with my father, we've been on this journey, like Charmaine, many, many years. We're going on our 17th year now. So, even now when he's in end-stage dementia in the nursing home, there are moments of joy that we can find with him, with the PSWs, as we go to visit him and take care of him. I say to people that, the more you try to tell yourself it's not happening, the more it's going to persist. And the more it persists without you actually being confronted, the worse it's going to be for the person with dementia and for the caregivers and the family.
Definitely. That's whole idea of stigma and, curses or generational curse or these kind of comments you get. That's, it's something that you've done in the past that come back to you is very common in some of our cultural communities. So it's almost like a shame for some people to talk about it. So after debunking those myths, I think that's where we say where the role of education is important to explain what it means. Similarly, in mental health presentation is a similar expression and a similar response. But I see there's an increasing acceptance in our communities around mental health now. So I'm very hopeful that people will start to see people that they know and love and trust is presenting dementia. So as time goes on, unfortunately, obviously the number is growing, and people that we know and love and care for in the broader community is probably going to help. But hey, who wants that, right? If we want to stop this thing. But yeah, so I think it's something we got to find. I think it's very grassroots work that we have to do by our community, not by whiteness, so to speak, but it's our role to play at the grassroots level at our community events and our churches and religious sites in these places. If it's come from the old model of MAD Canada about drinking and driving, or yeah, it's not gonna have the same effect. It has to come from grassroots, starting down from bottom up and ricocheting.
Stigma can also be very judgmental in our community. Again, having your spouse or a loved one go into a home causes people to be judgmental. Like, how could you do that? You're still able to take care of this person and you're sending them to a home. And so the fact that we need to be more understanding and maybe get information before, or not say anything at all, because you don't know how what that person has been going through prior to this decision, and it is their decision to make, and it's not up to us to let them know if it's right or wrong. It's their decision, because sometimes I find when we hear that our elderlies are going to the home for the aged, people will say, oh my goodness, they don't want to take care of them anymore. That's not the case.
Yeah.
Perhaps they just can't do it anymore. So yeah, we need to be non-judgmental, and we need to educate our elders and our young people. We need to educate, and most importantly, we need to stop not like it's a secret, don't tell anyone. We need to tell everybody. Like if you tell everybody, because when you know, someone else might have needed to know that. It's like when you're at school, they say raise your hand and ask a question, because there's 16 people behind you who wanted to ask the same question, but you had the courage to ask. So tell people what's going on so that they'll know, or they might have the help that you needed, but you didn't say anything. So don't be judgmental and tell people.
I think that's a really good point. If I may just add to that around the judgments. Have taken care of elders in our community. That's huge. And I'm also, been involved in that with my mom. And she had to stay at one of those chronic cares for a few days before we found a house, someone to come to the house, a PSW to come. The doctor felt comfortable that she can go home. And I have a really good friend who said to me, your mother is at this place. I said, yeah, they're waiting for her to find out medical care to come home. And I was like, well, I hope she can get out soon. I didn't tell anybody. And I didn't connect and say, oh, okay. She said, I didn't tell anybody in our network that your mom is there. And it was like 6 days or whatever day she stayed there for. And then I kept quiet too. I'm like, oh my God, yeah. No, to let them know it's just for the doctors find a new place, a medical support at home, then she can come home, that we could take care of her. So, and I think maybe it's generational too, because I tell my kids that I know that they don't have that kind of, they won't have that guilt thing because, and the judgment won't be there, because I think it's we're the first generation immigrant children. I am the first. My mother came and then I joined her, then we took care of her, but I don't think the kids were born here are gonna care if they're not gonna have that issue to put there, like people like me in the nursing home, which they have to if they need to. But yeah, that's a huge issue. Huge. And I know my African friends are like, oh my God, never. Can never put mom, never. We will die.